Hi, I'm Dr. Steven Ferguson. I have a large medical practice in eastern North Carolina. Big town called Powellsville. Really, it's a pretty small town, but we got big things happening here. We're going to talk about withdrawal today. We're using Suboxone in particular. And let's talk about the component of faith. Where does faith fit into this process? You got to believe. You got to believe that this thing is bigger than you. You already know it's bigger than you because you can't get off of it. But you got to know that there's something else out there. You got to have faith that you can do it. When a person comes in, one of the big things I say to them initially is, what's your why? Your why has to be big enough to get you to do what you said you were going to do long after the good feeling you had when you said it is gone. So what's your why? Most times your why is I've been kicked to the curb, I can't borrow any more money, I've lost jobs, I've lost my wife, I've lost my kids. Your why could be all kinds of things, but you got to have faith that you can do it. Suboxone is one of those drugs that can get you there. It's always excellent to have another source that's going to help you get through that process. Personally, me, it's Jesus Christ. But you got to have another source to help you through that, something you can believe in, something you can trust in. Suboxone works, and you got to believe that it does. I'll have patients come in, I wonder, is it going to work? When's it going to work for me? I don't know. You know, I tried all these other stuff in the past. It works. It works. Suboxone only, it doesn't put tape over your mouth. It doesn't tie your hands together. Okay, but it will help with the crave, it will help with the withdrawal symptoms. So you won't have to go through the nausea, the vomiting, the night sweats, the irritability, the stomach pain. You won't have to go through that, but hold tight now. You still got to believe that it's going to work, because you got to take it. And even if you don't believe it's going to work, but you got to take it. But it's so much better if you believe something when you start doing it. You know, every time I wean a person from one dose to the next dose, they're like, Doc, are you sure it's going to work? Or Doc, is it ready? Is it time yet? So a little apprehensive. But if you're with a healthcare provider that's got your best interests at hand, let's have belief and faith that they're going to work with you. They're going to get you in the right groove. They're going to wean you at the right time. And that's the process. So have faith that the process works. Come on in, see me, see another healthcare provider. Suboxone works. It really does. It's getting you off the opioids. Now, again, it doesn't work for cocaine, doesn't work for alcohol. Those aren't opioids. It works for opioids. So come in, see us. We'll be happy to talk to you about it. But you got to have some faith that it works. And a faith in something else often helps significantly as you move in the process, because there's more to this process than just taking the pill. There's a whole lot to whole lot of other components. We'll talk about that on another tape. But this is Dr. Steven W. Ferguson. Happy to see you. Office 252-332-6484. You can do it.